Is Hazel, and today I will be performing a nursing head-to-toe assessment. So let's get started. So before proceeding to the actual assessment, I made sure to gather the necessary equipments that I will be using and use alcohol to observe appropriate infection control. Hello, I'm Nurse Hazel and I will be your nurse for today. Today I will be doing a head-to-toe assessment which requires me to kind of touch you for precise findings. Will that be fine with you?
Yes.
So may I see your armbands? Okay. So your name is?
Lydia.
Your surname?
Ductante.
Your birthday?
March 10, 1965.
Okay, great. So how do you want me to address you?
Just call me Lydia.
Okay. Can you recall what's the day today?
June 2, 2020.
Do you know what we will be doing here today?
You're going to assess me from head to toe.
Okay, good. And who's the President of the Philippines?
Of course, President Rodrigo Duterte.
Okay, so you answered all the questions correctly and you are alert and oriented. Now I'm going to check your vital signs. Rest your arm here. Okay, your blood pressure is 110/30, so it's kind of low but still normal. And now I will be checking your temperature. And your heart rate and respiratory. Okay, everything's normal. So, are you experiencing any pain right now?
None.
None.
I'm okay.
You don't feel any pain at all?
Yes.
Okay, that's good. So to start from the head down to the toes, we're going to inspect the head for size, shape, and symmetry. Then palpate it to check if there's a presence of nodule, mass, and depression. Okay, your face is round, normocephalic, and symmetrical. There's no nodule, mass, and depression present on your head. The hair is black and evenly distributed. There's no presence of light. Okay, now, we're going to check your cranial nerve 7 or your facial nerve if it's working properly. Now, can you smile for me, please? Wider. Okay, good. Can you show me your teeth? Okay. Now, blow out your cheeks. Okay, raise your eyebrows and tightly close your eyes. Tightly. Okay, very good. You did all of that properly, which means that your cranial nerve or facial nerves are intact. Now, we are going to check for the sensations of the forehead, the cheek, and the chin to test if the cranial nerve 5, which is responsible for the mastication. So clench your teeth and I'm gonna feel your muscle which is right here. Okay, I can feel a large firm ball in here, which means this part is quite intact. Now try to open your mouth against resistance. Okay, close it. Okay, close, open it again. Okay, good. After that, I am going to check the temporal mandibular joint. So you do an close open routine of your mouth while I'm touching it, okay? Open your mouth, close it, open, then close it, open, then close it. Okay, that's good. So I'm checking for the clicking sensation, and in this case, I feel none. There's no swelling and crepitation. Now we are moving down to the eyes and inspect the external eye first. Okay. The patient's eyebrow is evenly distributed and is symmetrically aligned. Can you raise your eyebrows for me? Okay, put it down. Okay, thanks. So the eyebrows showed equal movement during its rise and fall. The eyelashes appeared to be equally distributed and curled outward. The eyelid has no presence of discharges, discoloration, and closes symmetrically. It approximately blinks 15 to 20 times per minute. The sclera appeared to be white. The palpebral conjunctiva appeared shiny, smooth, and pink. There was no tearing in the lacrimal gland. The cornea is transparent, smooth, and shiny. The details of iris are visible. The pupils are black and equal in size. Okay, that's good. We are going to assess your eye movement. First is the extraocular movement. So what I want you to do is to keep your head still. Look at me. Okay, don't move your head. Just use your eyes to follow where I'll be leaving this pen. Okay? Okay?
Okay.
Okay, so okay, good. You're doing great. And now what I want you to do is to look at my thumb and then my finger. Look at them alternately. Thumb, finger, thumb, finger, thumb, finger. Okay, that's good. So you can follow my instructions using your eyes. You can see the object's periphery when looking ahead with both eyes moves in unison with parallel alignment. Now we will be testing your corneal reflex, and I want you to open your eyes wide. And okay, that's good. I can see that your corneal reflex is intact. It is working just fine because when I place it near your eye blinks. Now we are going to inspect your ears. Have you been feeling any pain on your ears?
None.
Okay, that's good. So we're going to inspect your auricle and mastoid process for abnormalities, redness, or drainage, and then we're going to palpate it. Okay? Okay. The auricles are symmetrical and has the same color with her facial skin. It is aligned with the outer canthus of the eye. There's no abnormalities, no redness, nor swelling. The texture is nice and it's firm and not tender. The pin recoils after it's folded. Now I will be using an otoscope to inspect your external ear canal and the tympanic membrane. Now I'm going to pull the pin of your ear and then back to inspect it. Okay. Okay, can you move your head this side? Okay, thanks. I can see in here a sticky wet cerumen in various shades of brown, and the tympanic membrane is pearly gray in color, and that's good. We will be testing your cranial nerve 8, the vestibulocochlear nerve, using a hearing test. So Now close one of your ears, and then I'm going to whisper some words to the latter. Then tell me what you hear. Okay?
Okay.
So, are you ready?
Yes.
So, did you hear what I said?
Yes.
Again, close your ear here, then put this down, and then I'm going to whisper again, then tell me if you can hear me, okay?
Yes.
Okay? Did you hear what I said?
Yes.
So, what did I say?
Oh, good go.
Okay, that's very good. You heard me clearly. Now we're going to be using a tuning fork for Weber's test. So what I have here is a 256 Hertz tuning fork, and I'm gonna place it at the top of your head and tell me if you can hear the sounds everywhere in both ears or just either left or right, okay?
Okay.
Okay, I'm gonna activate it. Okay, did you hear the sound?
Yes.
In the left side or right side, both or everywhere?
Both.
Both ears. Okay, that's quite good. And now the last hearing test that I will be conducting is the Rini test. For the Rini test, I'm going to place this tuning fork at the back of your ear and then parallel to your ear, and tell me where you can hear the sound better, okay? Okay, where did you hear the sound better?
This part.
Okay, you heard the sound better in air conduction, so that means the Rini test is a success. So you did great during the whisper, the Weber's, and the Rini test. The results are good, which mean your cranial nerve and the ear are intact. So how's your assessment so far? Are you still comfortable? Do you want to be before we proceed?
No. Continue.
Okay, thank you. For the nose, I will be inspecting for any deviations in shape, size, and color. I can see in here that your nose is just fine. It's symmetrical, it has no discharge, and is uniform in color. Now I'm going to palpate it. Okay, it is not tender and has no lesion. Now let's move on to the maxillary and frontal sinuses. Okay. I can feel no abnormalities here. Now press the one side of your nose. Okay. And breathe on the other side. Okay. Good. Okay. Now the other side. Okay. Again. And the other side. Okay, the airflow is nice and the air moves freely as you breathe, and that's good. Now turn your face up, and I'm going to check the insides of your nose using pen light. Okay, good. I see no lesions. There's sufficient room for nasal passages. Mucous membrane is red. The nasal septum is in the midline, and I can see a clear and watery discharge, which is good. Now let's see if the olfactory nerve is working just fine. Can you close your eyes? Okay, very good. Now, can you recognize this smell?
Yes.
So, what is this smell?
Vanilla.
Okay, very good. Your smelling sensitivity is working just fine. For the mouth and throat assessment, I will be wearing a gloves, and if the patient is coughing, you might want to wear a face shield and mask to protect yourself from droplets and mucus. We are going to inspect your lips. Okay, your lips are dark red in uniform color. It is kind of dry, but is smooth and symmetrical. Now open your mouth for me. Okay, look up. Open your mouth wider. Okay, very good. Okay. The number of teeth is complete. It is white and shiny. The gums are kind of dark, but there are no retractions. It is moist. The soft and hard palate is in pink color. The hard palate has a regular texture and the soft palate looks smooth. So your UV lamp looks nice. I can see no problems at all. It is positioned in the midline. The tonsils are symmetrical and has normal size. It's pink in color and I can see no lesions or any abnormalities present. Now, put your tongue out for me. Tongue out, okay. The tongue looks geographic. It is pink in color. And now, turn up your tongue. I'm gonna look underneath. Okay, it's pink on dorsal and ventral surfaces. It is rough in texture and it fits comfortably in your mouth. Now what I want you to do is to open your mouth, put your tongue out, then move it to the left, and then to the right, then to the left, and then to the right, left, and right. So you can close. Are you having any difficulties moving your tongue?
None.
Okay, that's good. Your tongue can move freely. There's no problem in the movement at all. So I have to palpate your mouth, your tongue, to look for lesions. Will that be okay with you?
Yes.
Okay. Okay. It's soft and resilient. I can see no lesions nor sores here. Okay, you can close. Thank you. So moving on. I will be touching the back of your tongue to check for your gag reflex. Will that be fine?
Okay.
Open your mouth. I'm gonna put a finger in here. Okay. Do you feel like vomiting?
Yes.
Okay, that means that your gag reflex is doing just fine. Okay. The last thing we're going to check in your mouth is your taste sensation, and I have in here an applicator stick to check your senses. So now put your tongue out for me and tell me how this tastes like. Okay, close out your mouth. I'm gonna put it in the trash can. Now, how does it taste like?
Taste sweet.
Okay, good. You tasted it right. It's sugar. And out of all the tests that we've done, I can say that your cranial nerve 7, cranial nerve 9, and cranial nerve 12 are working just fine. You did good on all the tests for your mouth, and now we're going to check your neck. Now we're going to check your neck. Now lift up your chin. Okay, lift it up. Okay, I can see in here that the position of your neck is in midline. I can see a bump in here, which is not normal. Okay, so I'm gonna check your cranial nerve 11, the accessory nerve. Now what I want you to do is to move your head side to side. Okay, move your head to the right, back to the left, and then to the right, up, down, up, down. Okay, the normal. Then shrug for me. Okay, now try shrugging in the middle of the resistance. Shrug for me. Okay, okay, good. You did that with ease, which means your cranial nerve 11 is intact. Now we're going to palpate the trachea to confirm if it is midline. Okay, position. Okay. Okay. I can feel in here that your trachea is positioned midline. However, I can feel a big lump here, which is not normal. Okay. But now let's move on to the lymph node. Now I will be palpating for your facial lymph nodes. The pre-auricular, the posterior auricular, the occipital, the tonsillar, the submandibular, submental. Can you turn your head in this side? And the superficial. Okay. And now I will be auscultating your carotid artery. Okay, good. It's 2 plus. Going down to the upper extremities, we're looking for redness, for swelling, for lesions, and anything like that. Now we will be checking your capillary refill. I'm gonna press your nails. Okay, good. The colors came back in less than 2 seconds. Then we're gonna check the ulnar and radial pulse. Okay, they are 2 plus, which is normal. And then I'm going to check your brachial pulse. Okay, it's doing just fine. It's 2 plus, which is normal. And they're beating equally. Okay, now are you feeling any pain in your hands right now?
No.
Okay, good. Now I'm gonna check your skin turgor and see how fast it goes back. Okay, it went back really fast, which is good. And now we're going to check the range of motion of your elbows. Okay. Are you feeling any pain?
No.
Okay, good. Okay, done. Now we're going to check the range of motion of your wrist. Okay, extend it, then flex, extend, then flex. Okay, then move it to this side. No, do this, do this. Do this, then move it to this side, going inside, then move it this side, then move it this side. No, don't move this, just move your hands. Okay, the range of motion of your wrists are doing just fine. For the range of motion of your fingers, do this. Okay? No. Just this is straighten this part, straighten this part, and this. Then straighten this, and straighten. Then scatter your fingers, put it together. Scatter your fingers, put it together. Okay, the range of motion of your elbows, your wrists, and your fingers are just fine. It is good. It is normal. I will be palpating your hands. Okay. Okay, the color is normal. It is uniform in color. There's no lesions, no swelling, nor redness, and I can see no abnormalities in your hands. Okay, now I'm going to test your biceps, your triceps, and your brachioradialis using a reflex hammer. Okay, let me the first thing I'm going to check is your biceps. Okay, good. And then the triceps. No, bend your elbow. Relax it. Good. Okay, very good. And the last thing I'm going to check is your brachioradialis. Now relax here. Okay, there's a contraction of biceps and triceps, and while testing the brachioradialis, there is a flexion and supination of the forearm. So the next thing we're going to do is the rapid test, rapid alternative movement of your hands. Then place your hands on the top of your thigh and then rapidly turn it around. Okay, follow me. Okay, do it and don't stop unless I tell you to do so. Go faster. Okay, very good. Now you can stop. Now I'm going to test the sensation of the hands. Okay, I'm done. Now I want you to close your eyes. Don't open it until I tell you to do so. And lend me your palms. I'm gonna put an object here and feel what object this is. Can you recognize this object?
Yes.
Feel it.
Okay.
What is this?
Clip.
You can now open your eyes. That's right, this is a clip. And then the next thing I'm going to do is to write a number on your palm, and you have to tell me what number I am writing. Now close your eyes again and guess what number it is.
7.
Okay, right? That's number 7. Good. Now let's test the muscle strength. And to check your muscle strength, what I want you to do is to press my fingers as hard as you can. Okay, that's really good. And now push against my hands, and I'm gonna push against your arms. Okay, push harder. Okay, good. You have normal strength, so I can say that your upper extremities are doing just fine. There's no abnormalities at all. That's good. Now let's go down to the posterior and lateral chest. What to do is to continue sitting with your hands, arms at your side, and then turn back at me. Okay? I'm gonna check your posterior chest. Okay. The scapula are symmetric and non-protruding. The shoulder and scapula are at equal and horizontal position. I see no visible deformities. You are not using accessory muscles to assist the breath, and the diaphragm is the major muscle at work during your breathing. I'm going to palpate your chest, your posterior and lateral chest, to check for lesions, expansion, and masses. Okay? I'm going to check for your T9 and T10 if there is an expansion. Okay. Your T9 and T10 are just doing fine. It equally moves here. Your posterior back has no problems at all. It has no depressions, no masses. I can feel no lumps, and that is good. Now I'm going to percuss your intercostal space here in your back. everything is clear. Okay, now I'm gonna auscultate. Breathe in, breathe out, breathe in, and breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, and breathe out. Now, face me and I'm going to auscultate over your apex and sternum quarter. Okay. Everything's fine in your posterior lateral chest as I auscultate, percuss, and inspect. So your posterior lateral chests are intact. There's nothing wrong with it at all. Now we're gonna move on to your heart. Okay? Now I'm going to inspect and palpate for your umbilical pulse. Okay, which it is located at your fifth intercostal space. Okay, your umbilical pulse is 75, which is in the normal range. And now I'm going to auscultate for your aortic, pulmonic, Erb's point, tricuspid, and the apex of the heart, okay? We will be listening to the lub-dub sound. This is the aortic part, which is in your second intercostal space. And then your pulmonic pulse, which is in your second intercostal space also. And then going down to the Erb's point. Okay. And the tricuspid. And then the mitral or the apex of the heart. Okay, good. The sound dub is louder, which is good, and there are no murmurs as wishing and blowing sounds. I can hear no abnormal heart sounds, which means that you have no problems at your heart at all. Now we are going down to the next part. I'm going to auscultate and percuss your abdomen. Because I'm going to percuss. Okay, you can now sit down. I can see in your abdomen that the skin color is uniform. There is no lesion. There is a scar due to a surgical process, I guess. Right? So there is no venous enlargement. It is rounded. There are no visible asymmetries. There is no, when I auscultate your abdomen, there is no abnormal swishing sounds and gurgling sounds, and there is a tympanic sound over air-filled stomach and muffled sounds over fluid-filled or solid-filled organs. So your abdomen is soft. Are you feeling any discomfort in your abdomen? Okay. There is no, you can feel no discomfort that is elicited during the palpation, and the edge of the labor is palpable. I don't feel any lumps in your abdomen. There is no lesions and nor depressions. Going down to the legs, the feet and the toes, we're going to inspect the lower extremities for overall skin coloration, for texture, for moisture, masses, lesions, and varicosities. And I'm gonna observe the muscles in your legs and hair distribution, the range of motion, the pulsations, and all of that. Are you okay with that? Okay. Okay. Both extremities are equal in size. It has the same contour and prominence of joints. It has no involuntary movements, no edema. The color is even. It is uniform in color. It is smooth in texture. It is kind of moist. And the temperature is warm and even. It has equal contraction. I am now going to palpate your hips. The joints in your hips. It's kind of hard to palpate because of the fats. But I can feel in here that it's quite intact. Now I'm gonna test your range of motion. Flex your legs. Flex your legs. Okay, very good. Now extend your legs. Then abduct. Okay, good. Then internal rotation. Raise one of your leg 40 degrees. Okay. And external rotation, face your knee here on the side. Okay, very good. Now we will be moving on to the range of motion of your knee. What I want you to do is to move your knee. Okay. Then put it down. Move it up. Then put it down. The other legs. Put it up and then put it down. Okay, very good. Now we'll be checking the range of motion of your ankle. Now, can you... Yes. Flex your ankle. Flex your ankle like this. No, flex like this. Then extend. And then pronate for pronation. Okay. Supination. Okay. It's okay. Then the other. Flex. 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 Extend. Pronate. And then, yeah. Very good. The range of motion of your ankle and your knee are doing just fine. It has no problems at all. You can move the ankle and the knee freely, which means that all your nerves and the ankle and knee are intact. Okay, now I will be checking for the capillary refill of your feet. Okay. The capillary refill is doing good. The color came back in less than 2 seconds. I'm gonna palpate your ankle, and the first thing I will palpate is the extensor hallucis longus. Okay, it's good. can feel no lesions, no depressions, and it's 2 plus. And then the dorsalis pedis. Okay, the dorsalis pedis is 2 plus. And then the tibial anterior tendon. Okay, your ankles has no problem at all. It's 2 plus, it is normal, which is good. And now let's move on. I'm going to conduct the heel to shin test. Now I want you to move one of your legs to your shin, heels to your shin. Okay, very good. And then then the other heel. Okay, good. Put it back. So the coordination is normal, they are equal. I can see that there is no loss in the motor strength and there is no cerebral lesion. The motor are working just fine and it's intact. I'll be testing the sensation and I will be using the pain sensation test. Okay, tell me if you can feel the pain as I... Is it painful?
Not really.
But can you feel the pain? Yes, okay. I can see in here that your sensations and the legs are intact. I'll be checking your back to check for curvatures or scoliosis. Okay? Turn around. I'll be looking at your back. Okay. Okay, you can praise me. Okay, I can see no curvatures. There's no presence of scoliosis, and that is very good. Hop one of your leg again, then the other leg again. Very good. One of your, and then reach my index finger. Okay, very good. The result of the finger to nose test is your movement is coordinated. The upper extremities movement is doing great. This sums up our head to toe assessment. So how are you doing so far?
Feeling good.
Are you feeling any discomfort right now?
No.
Oh, and so to sum up the findings of your assessment, so your body is just fine, everything is working good, the range of motion is good, the abdomen is good, the neck has a little abnormality here, which is an enlargement or a big lump here in your thyroid. The head is good, there's nothing wrong with it, your vision is good, the nose is good, the mouth and throat is good, your ankle, your legs, your head to toe is good, just except this enlargement here. So your skin color is uniform to your whole body. Your hair is evenly distributed, and that's it. So do you have any questions?
Nothing.
So thank you for active cooperation and good day.
Yeah.
So after the head to toe assessment, we have to observe proper sanitation. Okay. And then we have to document all of the findings in the chart. And we have to clean the equipments that we used and even have to sanitate the tools that we use on the patient.